Hello, welcome to Aditya Jyoth for the program on artificial retina. We have Professor Marco Mura from Netherlands who already gave a oration yesterday in my parents' name, Professor Kamala Sundaram and Professor Enna Sundaram oration, where he spoke on artificial retina. And we have our old friend of Aditya Jyoth, Mr. Shmita Gubna, who will help us to understand what Professor Marco Muro is doing in Europe.
Thank you, Dr. Natarajan, for giving me the opportunity to be part of this small event. And welcome, Dr. Mura. My question, Dr. Mura, is would like to know what is Argus 2?
Argus 2 is a system, so-called retina prosthesis, which is a system that allows to stimulate directly the retina and to restore partially vision in blind people affected by retinitis pigmentosa. It is two parts. One is implanted inside the eye itself, and there is an external part which is made by a pair of glasses with a camera mounted in the glasses themselves. The system works in this way. The camera receives the image from the outside world, and this image is sent to a small little computer that the patient wears all the time. This computer, which is called VPU, Video Processing Unit, it processes the signal in a way that is made more comprehensible and easier to be transmitted to the microchip itself. The microchip itself is implanted through via surgical operation in the eye of the patients. So when the patient wears the glasses, it can basically receive information from the outside world through the camera, and this information is sent to the chip and the optic nerve to the brain, so that the patient can have some pattern of lights that he has to learn to interpret in the future through a rehabilitation program.
Dr. Murai, I also would like to know what are the requirements for getting this Argus 2 implanted?
The requirements to have the Argus 2 implanted are several. It is first of all a device which is intended to restore vision in patients affected by retinitis pigmentosa. Patients that are eligible for the implants are usually patients in the major age, so 18 and above, which have deeply to profound loss of vision. So patients which have still some visual function are not eligible for the implantation of this device. And they have to be affected by retinitis pigmentosa. That is really important. Also, patients who were born blind are not eligible for this type of device because patients have to have had previous experience of vision to be able to interpret the pattern of light that the device gives them.
So fantastic. That means a person who is having retina pigmentosa, who had some vision earlier and now has no vision or very less vision as only light perception, what we call in our blind community is only light perception, not in even to understand, he can or she can understand what is the difference between light and dark, that's it. So that kind of a person is more eligible or highly eligible for to go for this artificial retina implantation. Great. My next question to you is, Dr. Mura, is how much eyesight one can expect after this surgery?
So it is very difficult to talk in terms of how much eyesight a patient will get. That is depends on many factors. First of all, the condition of the retina at the moment of the implant. Second, the flexibility of the patient to try to learn this new language, because remember, the sight that this type of device gives is not the sight we are patient used to have in the past. past. It is a new form of vision, that's why we call it artificial, and basically what the patient gets are some, as I said, patterns of lights, which can, patient has to learn how to interpret. Said that, there are also patients, which are the best patients we had in our group, is about probably 10 to 15% of our population of patient implanted, which were able to really read normal characters and to recognize them. And in those patients, we could maximally achieve, those small group of patients, we could maximally achieve 20-100 vision, which is about 660s. So it's just the biggest, the first character on the chart. But that's not the main goal of the device. The main goal of the device is try to give patients more independence, to try to help them improve their mobility, to be able to go around in the open space, maybe with the stock only, without the use of a dog, or without having always somebody to take care of them. And really improvement in the mobility is the major goal of this device. And amount of vision of character read, this is a secondary goal, and it can be achieved, but in a very small amount of patients with a good training.
Fantastic. So, if I would sum up the answer to this question is that post surgery, a patient needs to undergo proper training by which a person can see objects, understand the obstacles in his or her path, and can help in his mobility.
Yes, exactly. You understood correctly.
Great. I would like to know what is the cost of this surgery?
The cost of the surgery in Europe, plus the cost of the device altogether, is about 150,000 euros. And this includes, as I said, the cost of the device, the surgery, and the rehabilitation program. All these patients, after having the device implanted, they need intensive training course, which lasts 3 months. Every month, every week, 3-4 hours of training, and also some exercises that the patient has to do in his own environment. And this is extremely important for the good functioning of the device. Without the training, the device and the operation is actually not so useful.
Not so effective.
Yeah, exactly.
I know it's, as I've understood, that this device is more for retina. Doctor, as myself, I am a patient of retina detachment and a macular hole. I would love to know that whether this device is useful for people like me and also with person who are suffering from macular degeneration.
The device at the moment, unfortunately, cannot help this type of disease. Is only approved and only used for the treatment of retinitis pigmentosa. So unfortunately, people with have other eye disease like retinal detachment, glaucoma. I heard yesterday somebody asking about diabetic retinal detachment. All these pathologies have their own treatment, which is some of the time surgical, but they cannot be helped with artificial retina. Unfortunately, it's only meant for people with retinitis pigmentosa at the moment.
So, sir, you mentioned that the cost of the surgery is around 150,000 euros. So, do you think if it's funded, it can be done in India?
Well, of course. I mean, the problem of the financing the device is also a problem we encounter in Europe. There are now several countries which have got it approved in Europe by the insurance company or by the state, which cover the cost of the device. It is for sure a big investment for a patient, especially also because this type of diseases are very more common in people which have no high income. So, and that has to be, of course, sponsored or by a governmental institution or by insurance companies, or like we had in the beginning by private funds. We had a lot of help in the beginning of our experience by foundations like a blind foundation, RP Foundation, that donated a lot of money to be able to start implanting the device. And once we had the device, first devices in place, we had a lot of attention from the public opinion, and that helped us a lot in having the recognition of the treatment in our country. So probably that's the first step to be able to show that the device works. and to have basically the governmental institution have it reimbursed.
Yeah, because I know a family where 7 people in the family all suffer from retina pigmentosa, and they are from an hand-to-mouth situation. So for them to undergo this kind of a surgery, it's really, really a big task.
That's why from our Aditya Jyot research in vision ophthalmology, we would like to appeal to the public and the government that if we have somebody can fund, because even the company which makes that second site, they want at least minimum 5 implants to be ordered and then tried as a, even as a clinical trial, even though it's applied approved in US FDA and Europe. So again, who has to fund it? Because I think the government has funds in science and technology, and we also look for philanthropists to give funds for this, so that whatever little they can get, I think it'll be useful.
So, Dr. Natarajan, I would love to understand that how this surgery can be introduced in India.
Actually, my dream is to introduce in India. That's why I invited Mark Humayun, who was here in 2004, and after that, several experts have come. And recently, even from second site, people visited our operation theater. But finally, we also filled up the form. But I think they want at least somebody to order at a time 5 implants. That means one is the number of implants, and second the amount of rehabilitation to be done for them. So that means you have to commit for 5 implants to the company, then they will be able to arrange to get in India. And after that, I think after funding, we also need approval from government of India, and then only I think it will be possible to introduce in India. So finally, it's mainly only money.
Dr. Mura, I have another question for you, is that what are the other options available for artificial retina else than Argus 2?
At the moment, Argus 2 is the only device which is FDA approved and CE marked. Those are the two major recognition marks that a product has to have to be implanted in people in Europe and United States. So if a device doesn't have these marks, it cannot actually be implanted. So said that, there are also other companies which are studying and experimenting other devices. One of them is a German company which recently came out with a subretinal implant, a little different approach than the Argus 2. It was also CE mark. The problem with that implant is that at the moment is not very robust and reliable, and the longest period of the device worked was just 12 months. So after 12 months, almost 70% of the devices had failure, and they were not working anymore. But there are a lot of other groups in the world. There is one group in Australia, one group in China, for example. They are studying new approaches with new types of implants. But nowadays, until I think for the next couple of years, the only available implants is the Argus 2, and that's the only one the patient can get on a regular clinical basis.
Is bionic eye and Argus 2 same, or do you both are different?
Yeah, you can call Argus 2 also bionic eye. I mean, they give him several names. It is the only one available that can restore some vision in blind people. We call it retina chip. You call it bionic device, bionic eye. Yes, it is an electronic device which helps blind people to have some sort of residual vision. Yeah.
And how much is the success rate for Argus 2 surgery, post-surgery success rate?
But the surgical procedure of implantation is a quite safe procedure. It is a sum of different type of procedures that vitreoretinal specialists are used to do in the common practice. So the success rate of implantation is very high. It is for sure above 90% that the operation successfully goes without any complication. Also, the complication post-operative are very low, for sure in the range of 5 to 7%. So it is a quite safe procedure, a small amount of complication, and it lasts very long because the first Argus 2 was implanted 8 years ago and is still is functioning properly in the patients.
So I would also like to know the progress over on stem cell treatment. How is that going on?
There are several approaches for the treatment of retinal disease. All of you probably, if you go on internet and you Google, you will find a lot about gene therapy, you will find a lot about stem cell treatment. And of course, not this type of technology cannot be applied to all the pathologies, because also when you go and talk about some new product or some new advance in ophthalmology, what happens is that a lot of patients are always asking about referring, is that technology also applying to my condition? Unfortunately, there are some of the conditions, the most diffuse, like here in India, like retinal detachment, diabetic retinopathy, retinopathy of prematurity. Those cannot be treated with this type of technology. Also, stem cell regrowing a retina, it is of course of regrowing the photoreceptors, of course, a very challenging and exciting development. There are a lot of trials going on, mainly on the inherited disease. And in macular degeneration, to try to let some of the layers of the retina regrow. But they are all still in experimental phases, and they're not available routinely for patients. Okay. And I think it's going to be several years necessary from now before we see something available on the market for a routine patient.
So as of today, if I understood rightly, it was the stem cell treatment is also not available for, actually it's not available for any patients, but still the research is not even open for retina detachment or macular hole or retina degeneration kind of.
No, the treatment for retinal detachment and for macular hole is pretty surgical, and it happens already many years with the vitrectomy operation. But there is nothing really that at the moment stem cell treatment is not really addressing patient with retinal detachment. Fortunately, the success rate of vitrectomy and buckling for retinal detachment surgery is quite high. We can achieve a quite good anatomical result. So to have the retina in place, but you have to understand that anatomical and the function of the eye are not the same. Sometimes we can achieve a good anatomical result, but the eye still doesn't work. So the next step, the next goal for us is not only make sure the retina goes anatomically in place, but try to improve also the function. And for that, there are also studies going on. It's not about stem cells, but it's more about growth factors and things that can keep the retina alive, molecules that can keep the retina alive in the period while we are doing surgeries. Because I think the treatment for retinal detachment will be and will still be surgery for the near future, but the goal is try to protect the retina in that period, to avoid that the optic nerve, for example, get damage of the ganglion cell, go and die. That I think is more realistic than stem cells at the moment.
So that's fantastic to hear that some study is going on.
Yes, sure. There is a lot going on, but it's not in the sense of stem cell. It's another field.
So almost you answered part of my question already. That what is the road ahead for all the research is going on for artificial retina? How do you feel that next 10 years? How do you
artificial retina, there is a lot of research going on in several sectors of the artificial retina in general. The first, if you are talking about, for example, what Argus 2 and Second Sight is doing, in the near future there is going to be improvement in the hardware of the system. For example, improvement in the glasses in the camera, some new upgrade in the software from whom patient can have a zoom function, for example, or they will be able to have the facial tracking system in the camera. All these little software and hardware improvement will make the use of the device easier for the patient and will improve also the usability. That the patient can basically interact with the surrounding environment, with surrounding people easier. Also, there is a study, they're studying on a new type of prosthesis with a bigger number of electrodes, and we are trying to understand if this bigger number of electrodes will bring also benefit for the patient, because number of electrodes is not directly correlated to the function of the patient. Sometimes a patient with a smaller number of active electrodes in the device can function better than patients with all the electrodes activated. So first step is to understand if number of electrodes is an issue, if more electrodes can help patient, and if that is the case, I think it will be implemented in a next generation of device. Also, what they are trying to do is trying to create to enlarge the visual field of the patient. Nowadays, the visual field that the patient can get with a retinal prosthesis is quite small, it's just about 20 degrees. What we are trying to do is trying to see if the Argus 2 can be combined with the other devices which can give more peripheral vision. And these devices can also be implanted in the eye, but they will have a different function and then a complementary function to the Argus 2. So this is really going on at the moment, and of course there are also other groups studying a different device, as I said, like the subretinal location of the device, and that is what at the moment is going on.
Yeah. So actually, the yesterday's talk during the oration on artificial retina, he has covered it as for the layman. So where I hope we will put that up in the YouTube, and he has given us permission to show that, so that people will be aware. And I think one thing I learned yesterday is people who are born blind cannot get this implant, and people who have other retina problems like retinal detachment or glaucoma or any other retina problem cannot benefit. But what can benefit is the retinitis pigment patient who are going blind or almost blind, they can benefit, and for which we need the NGOs, foundation, and the government agency to support this. Even though the amount of money spent is so huge and the amount of vision getting back is so little, still there is a ray of hope for the blind, so that one day the blind shall see. Thank you, Marco, and thank you, Shushmita, for the interaction, and I hope the people will benefit from this discussion. Thank you.